Hi guys, welcome to my channel. This is Parneet here again, and today I'm going to talk about post-dural puncture headaches. Post-dural puncture headaches usually happen after a procedure such as spinal, done usually for the cesarean deliveries, and epidural, which are usually done for the labor pain for the childbirth. Very rarely it can happen in people with the connective tissue disorders, but that's one of the zebras. Most in general population, it is usually done, it usually happens after a procedure. The reason why you have these headaches is because there is a dural tear and there is some CSF leak. Let's talk about symptoms first, and then we'll go into the anatomy. The symptoms usually start within 48 hours, can go all the way to 5 days after the procedure. Symptoms feel like a traction, a pull, a neck stiffness, some pain in your front of your head. You can have some blurry vision. You can have some ringing in your ears. The reason why you have all these symptoms is because there is a CSF leak. So your brain, and then you have your spinal cord, which is bundle of nerves. This bundle of nerves is surrounded by a fluid, which is called as a cerebrospinal fluid. Then this whole structure is wrapped in a wrapper, which is called meninges. If you had a little tear on this wrapper, then the fluid from inside can come outside, cause the lower pressure inside, and then that start causing that traction. That traction or that pull causes the activation of the pain-sensitive meninges, which causes your symptoms. The newer teaching is we do have something called a dural venous sinuses, and because there is a lower pressure inside of this channel, these particular sinuses tend to have hypervolemia, dilation to compensate for the lower pressure, and then that further causes the activation of the pain-sensitive dural venous sinuses, and that cause your symptoms. So these are the reasons why you get it, but not everybody who had a spinal or epidural get these symptoms. There was this large study done with 200,000 people, and they came up with a ratio of 1 in 144. So after they did 144 procedure, one person ended up coming with the post-dural puncture headache. And out of all the people that ended up getting post-dural puncture headache, 40% of them got better on its own. The remaining 60% needed some kind of intervention, which involves the epidural blood patch, which I will discuss in a bit. So treatment for your post-dural puncture headache is usually conservative. It's bed rest, hydration, oral hydration. You should drink as much water as possible. You should drink caffeine. You can also have a Tylenol. You can have some medications such as sumatriptan, gabapentin. All these have clinically shown to have an effect and symptomatic improvement in patients. There has not been a big, large study which has shown like evidence or a support towards these treatment, but clinically I myself have seen changes in symptoms of the patient and improvement in symptoms of these patients by the conservative measures. If it is greater than 24 hours and you're still experiencing this headache, what your anesthesiologist can do is called the epidural blood patch. So let's review the anatomy again. Remember the spinal cord, then you have a fluid around it. It is wrapped in a wrapper. Right outside of this wrapper, you have this empty space called as the epidural space. You will take your own blood. I will get an IV, get your own blood, 20 cc of your own blood, and I will put it in this empty space. What that does is basically causes the epidural hematoma, where higher pressure is created outside, which tend to leak, stop that leak of CSF, and the CSF stays inside. Most people feel immediate relief after the epidural blood patch. Very rarely, it is possible that you have to do a second epidural blood patch to see a symptomatic improvement. And after the second blood patch, most people don't have symptoms anymore. So this is the treatment for it. It can be very debilitating, for a young mom, or for a mother who just had a baby. You're unable to sit up, you're unable to do your daily activity after the childbirth. So it can be very debilitating, but the good thing is that most people get better, either on their own, or they get better after the treatment. So this is one of the risks, and this is one of the things I wanted to discuss about the post-dural puncture headache. If you guys have any questions, and if somebody have an experience with it, they want to discuss it, put that in the comments below and let me know. Thank you.